You are welcome to my channel. Thanks for visiting. Today, let's take a look at Atorvastatin under the brand Lipitor. Join me to check this note before we proceed. The role of diet is pretty important in all aspects of medicine. Here, diet control will be the key in dealing with cholesterol level. So it is advisable to reduce cholesterol diet-rich foods for 6 months before the onset of therapy. And even with the therapy, you still be on diet control for life. Also, let's consider all women of childbearing age. Are they pregnant or about to be pregnant? Before using statins, it is advisable to rule out pregnancy. And as a matter of fact, when the woman of childbearing age is on statin, she's expected to be on contraception. And that should be at least 2 months before the onset of the use of statins. And that contraception should be in place throughout the time that she will be on statin, and at least 2 months after the statin has been stopped. That is for all women of childbearing age, because statins and pregnancy are not friendly. Watch this. The use of grapefruit, grape juice, that will inhibit the enzyme that is meant to metabolize statin. And with your grape juice, grapefruit, and everything grape in the system, the level of Lipitor will be high because metabolism will drop. Diabetes mellitus, and anyone monitoring blood glucose level should be careful. While monitoring diabetes and you are on Lipitor, your hemoglobin A1C will rise beyond expectation, just as blood glucose will also rise. So you can take note of that. Atorvastatin could be under different brand names. You can pause and check and compare that to the one available in your country or jurisdiction. Atorvastatin is anti-lipid, anti-lipidemic agent, and specifically HMG-CoA reductase inhibitor. Now, because I've been mentioning HMG-CoA a lot, let's examine what HMG-CoA is all about. HMG-CoA is 3-hydroxy-3-methylglutaric coenzyme A. The HMG-CoA reductase will catalyze the reduction of this HMG-CoA to mevalonate. The mevalonate is the rate-limiting step in liver cholesterol synthesis. Statins would target the enzyme, the HMG-CoA reductase, and by that decrease cholesterol synthesis capability. Forms of tablet like 10 mg strength, 20, 40, or 80 could be generic. Atorvastatin 10 to 80 mg tabs. Uses: in prevention of atherosclerotic plaques, we use Lipitor or Atorvastatin. Coronary artery disease, peripheral vascular diseases, overweight or obesity, kidney transplantation or heart transplantation, in diabetes mellitus with a target. Low density lipoprotein is not expected to be greater than or equal to 130 milligram per dl. No, it should be below 130 milligram per dl. In hypercholesterolemia, we use statin. Still on uses, anyone will look for atorvastatin to reduce total cholesterol, reduce LDL, apolipoprotein B, and triglycerides. But at the same time, targeting the possibility to increase HDL. I will explain further in a bit. The goal is we want the total cholesterol to be less than 200 milligram per dl. And we want LDL to be less than 100 milligram per dl. That would be the best. But anything between 130 and 159 milligram per dl is the borderline. And triglycerides is expected to be less than 150 milligram per dl. While high density lipoprotein will be expected to be high as 60 milligram per dl, or even greater will be the best goal. But if it is 40 milligram per dl, that is good enough for men. In women, we need it to be higher than that at 50 milligram per dl. Contraindications. We cannot use Lipitor if there is history of hypersensitivity to Lipitor or any components of its formulation. When there is ongoing liver disease with evidence of raised enzymes or abnormal liver function test report, we cannot use it. In pregnancy, no. Breastfeeding, no. Anyone taking cyclosporine, no, we cannot use it together. Then, many antiviral agents cannot be used with statins. The dose. In anyone 6 to 9 years, well, you can start with 5 milligram once daily. You review and gradually titrate to the maximum that is applicable in this age group is 40 milligram once daily. Under certain conditions, they may also receive up to 80 milligram once daily, but that will be determined by your physician, and you can confirm with the pharmacist. The individuals between ages 10 to 17 and older can receive 5 to 10 milligram once daily, and maximum is 80 milligram once daily. Dosage adjustment. We can increase or decrease the dose of Lipitor every 3 months and sometimes as long as 12 months. Why that? If someone starts using Lipitor today, you might not be able to determine the efficacy so quickly, or you might not be able to judge the response, because that will not be until about 1 to 3 months. Administration. Atorvastatin is expected to be taken whole, meaning don't break it. You might take it with food or without it, and you can choose to take it at any time of the day, provided you'll be able to remember. Consistency is the key. That is why some physicians will say, take it every night, and some will say, okay, the long-acting one, take it every morning. The reason why they prefer every night, one is the consistency, so that you can remember that while you are going to bed, you take it. And the second factor is cholesterol is produced at night. So I would suggest take it at bedtime. Take it every evening. Mechanism of action. Remember that atorvastatin is a synthetic compound that inhibits HMG-CoA reductase competitively. Here, conversion of HMG-CoA to mevalonate will be prevented. Then cholesterol synthesis will be hindered, and hepatocytes will take up more low-density lipoprotein, thereby decreasing the level of LDL in the blood. Then there will be a associated drop in the level of triglycerides as well, while the level of HDL will be raised. If you give atorvastatin high dose, you are already causing anti-inflammatory effect of it, and at high dose, it will be able to stabilize the plaque the more, and even plaque regression is a possibility at high dose. But before you rush to give that man or woman high dose atorvastatin, let's get to the side effects. Now, let's get to the side effects. Myalgia. Myalgia and creatine kinase will reveal creatine kinase that is raised, but not so scary. There are muscular problems, yes, muscle pain, but you can only trace it to statins that you are using. In myopathy, creatine kinase will be 10 times the upper limit of the normal level. Here, there will be significant muscle pain, and you cannot attribute this to any other reason or reasons besides the use of statin. At the same time, there will be muscle weakness due to the statin you are using. Immune-mediated necrotizing myopathy will give us both raised CK that will be so significant and antibodies to HMG-CoA. Another major side effect is rhabdomyolysis, and here creatine kinase will be off the roof, will be as high as more than 40 times of the upper limit. This will be associated with myoglobinuria, and the kidney will be failing. The risk factors associated with the possibility of coming down with myalgia, myopathy, and rhabdomyolysis will include muscle disease, muscular diseases, renal failure in this person before the use of statin or aggravated with the use of statin, frail patients, elderly individual, someone with low body mass, some Asians, some females, hypothyroidism, heavy exertion, and trauma. Other possible side effects besides the three major ones will include alteration of diabetes mellitus factors under test, the glucose and hemoglobin A1C that will both be raised. And so also will be higher level of liver enzymes. There might be associated nausea, loose stool or indigestion. It can damage the pancreas, giving up pancreatitis, and possible reversible memory loss. Good thing that the memory loss here is reversible. Monitoring. Before the commencement of the therapy, let's have baseline data, the liver function test, renal function test, pregnancies being screened, blood glucose, lipid profile. Let's have that done first before you start taking the medication. Then let's have CK done. CK will guide us whether we will be dealing with myalgia, myopathy, or rhabdomyolysis as been explained before. Immune antibodies should be acid, particularly against HMG-CoA, telling us whether no myopathy is due to autoimmune here or not. The lipid panel, again, will be repeated every 4 to 12 weeks after starting Atorvastatin. Then we will space it, the frequency will drop to every 2 to 10 months, or some authorities will say every 3 to 12 months. We will not stop checking what is going on with the liver and the kidney. So renal function test, liver function test, liver enzymes will all continue. While periodically blood glucose level will be acid. Remember, once again, I've stated earlier, but I will repeat here, that efficacy cannot be determined so quickly. The response will not be until about 1 to 3 months after the onset of the first use. Lower density lipoprotein, less than 40 milligrams per dl, means you are winning. You are winning. You are doing well. And at this level, you may talk to your pharmacist or anyone in authority in your jurisdiction and start decreasing the dose. Let me repeat. Once LDL is less than 40 milligrams per dl, then you can congratulate that patient and start thinking as per possibility of reducing the dose. I'm not saying possibility of stopping the medication, no, but reducing or decreasing the dose. But discuss with someone, an expert around you. Drug-drug interaction. To those who are familiar with my channel, you are aware that I don't usually delve deeper into this. But for the sake of those who will be taking this medication, you cannot take statin and fibrate together. No. Example is Atorvastatin, Lipitor, and you take it with gamfibrozil? No. Or you want to take it with fenofibrate? No. Don't use them together, please. And you're on statin, and then you have been given nicotinic acid. Well, you run the risk of having greater probability or possibility of rhabdomyolysis. And that will present with the myoglobinuria and renal failure. You like fruits, but this is not the time to go for grapefruits. You are taking grapefruits, grape juice, and statin. You are going to increase the level of statin in the blood because metabolism will be inhibited and the possibility of side effects will increase. Or else, you have to be taking less dosage, subsequent dosage times. But beyond this level, and even this level, still discuss with your pharmacist, your physicians or your colleagues, and clinical pharmacologists. In conclusion, there's nothing without both merits and demerits. Statin is good in helping us to deal with cholesterol and triglycerides, but could be bad if certain precautions are not taken. Thanks for listening. Remember to share this. Remember to subscribe to my channel. I appreciate it.